September is the month of PCOS awareness, and I am so glad it's getting the attention that is much needed.
Today, I'm in conversation with Dr. Gunjan, who is a veteran gynecologist. She has served the Indian Army for 24 years.
It is this is a PCOS month, we know that. Why we are giving so much of stress to this particular disease? Because of the incidence, as you mentioned. It is as high as 22.6% in our own country. And why is it so? Because we don't have healthy lifestyles, we don't eat healthy, and we don't exercise.
Let's talk about what are the symptoms of PCOS.
Many times, in my own practice also, sometimes a lady comes with a 17-year-old daughter and with the scare of the thing that she has missed a few periods or had some irregular periods, and somebody told them this is PCOS. And they come to my clinic with that scare in their mind. But actually, if you, technically speaking, it's called as the Rotterdam criteria. 2 out of 3 criteria have to be fulfilled to call it PCOS. So the first criteria is if a patient is having an ovarian dysfunction in form of an anovulation or oligomenorrhea. That means her periods are coming after 45 days and the amount of blood that is coming out is also less during menses. That is the first thing, that is the ovarian dysfunction. Second is having hyperandrogenism, that is biochemical markers of hyperandrogenism along with the features of hyperandrogenism. Now what is that? She would have acne, she would have a male pattern of alopecia, and she will have hirsutism. Hirsutism means that lot of hair on the face, chest, body. So that is the second criteria. Third criteria is polycystic ovaries.
In any case, women have a concern about weight, and in PCOS, there is a close linkage between the weight and PCOS. How does it work? In which direction? If you lose weight, does PCOS reduce, or if the other way around, how is it?
I think it is vice versa. If the person is overweight, there are certain patients who may not have more weight, but they still become PCOS, that is a lean PCOS.
Yeah.
But then in obese patients, the chances of the complications related to PCOS will be more, and it will be more grave. But here I would say, when the stress is more, the adrenal aspect of PCOD becomes more prominent. Because from the adrenals, the hormones which are secreted, again they will increase the testosterone.
And lastly, I would like to say this, that we spoke about lifestyle impacting PCOS and in fact the whole mind-body health of anybody, any individual. But if we come to women specifically, because in recent times we have seen a great surge of women in workplaces, rising to senior positions and really being very ambitious. Sometimes in the effort to prove themselves and find their place, they lose the balance between their health and work. This is just a reminder for everybody that if we don't focus on our health and our lifestyle, eventually everything in our life will be impacted. Our entire life experience of joy and happiness for which we do everything will be impacted. So just a gentle reminder.